Good afternoon, and I wish you all a very happy Doctor's Day. So, on this Doctor's Day, just I wanted to disturb you with one small topic called as the prostate. Okay, so let us look into this topic, prostate gland. So, it's a pear-shaped structure which lies inferior to the urinary bladder, and this prostate gland basically it is a fibromuscular structure, right? It's a fibromuscular structure. Why the muscles fibers are there is because in order to make the bring about the contractions of this prostate, which can result in the evacuation of the secretions of the prostate into the urethra. So before going to the details of this prostate gland, first of all, just wanted to show you this is the prostate gland. Okay, it is located just underneath the neck of the urinary bladder. And if you take this prostate gland, like anteriorly, you can see this is the pubic symphysis or the pubic bone, pubic symphysis, and you can see the anterior abdominal wall here. And from the pubic symphysis towards the prostate, there is one ligament called as the puboprostatic ligament. This is the puboprostatic ligament. At the same time, above you can see the urinary bladder, and just behind this urinary bladder you can also see another structure called as the seminal vesicles. So there are two seminal vesicles for each side, okay, and these seminal vesicles will end with the help of these ejaculatory ducts. So you can see this is the ejaculatory duct, which is the important site for division of the lobes of the prostate. And along with this, just behind the prostate gland you can see one important structure called as the rectum, right? So this rectum, as you know very well, it contains of it has two curvatures. One is the sacral curvature and also the next one is the rectal ampulla, right? So this is the rectal ampulla where the rectum bends at this level, okay, and continues as the anal canal. So please remember, this is very important one, that is the rectal ampulla, right, and the anal canal leading to the rectal ampulla. At the same time, once you see this peritoneum, that is the parietal layer of the peritoneum, once it reaches this level, then it will reflect back over the rectum in the form of visceral peritoneum. You can see the visceral peritoneum, and then this peritoneum will continue over this, like over a part of this rectum anteriorly and laterally, and then from just once it reaches this level of the rectal ampulla, this visceral peritoneum will reflect back. It will reflect back over to the urinary bladder covering the seminal vesicle. Then it will reflect back over the urinary bladder, and then it will cover the complete and like superior surface of the urinary bladder, where again it continues in the form of the parietal peritoneum towards the anterior abdominal wall. So this is all about the peritoneal coverings, but while reflecting back here at this level, this visceral peritoneum forms a potential space called as the rectovesical space or the rectovesical pouch. So at the same time, this rectovesical pouch still continues. This rectovesical pouch continues. So this is a potential space called as the rectovesical pouch, but this peritoneal layer, it continues downwards here like this in the form of a fascia, called as the fascia of Denon-Villiers. This fascia is nothing but called as the fascia of Denon-Villiers. So now you can see the rectovesical pouch with the fascia of Denon-Villiers or the Denon-Villiers fascia. So these are all the contents which are there, but in front of this urinary bladder you can also see, in front of the urinary bladder, excuse me. So in front of this urinary bladder, you can also see some space here, potential space, which contains the loose connective tissue called as the retropubic space of Retzius. Okay, it's also called as the retropubic space or the space of Retzius. So anterior you are seeing the space of Retzius, and posteriorly you are seeing the fascia of Denon-Villiers. So at the same time, anteriorly this prostate is related to the puboprostatic ligament. Okay, and just below this prostate you can see a diaphragm here which separates the genital organs from the urinary tract organs, that is the urogenital diaphragm. So this is the urogenital diaphragm, and now within the substance of the prostate, this urinary bladder neck, it continues as the prostatic part of the urethra. This is the prostatic part of urethra, right? So these are all the things which we have to know, which are related to the prostate gland. Next one we will see. So previous slide which I have shown, that was the only sagittal view of the prostate gland. But if you take a coronal section, if you take a coronal view or a coronal section at the level of the prostate gland, you can see this is the clear prostate gland with prostatic urethra, right? Prostate gland with the prostatic urethra, and on either side of the prostate you can see one important muscle here. This muscle is called as the levator ani muscle. Okay, this is the levator ani muscle. So this is very, very important to remember. Now you can see this is the neck of the bladder. Here is the neck of the bladder, fundus of the bladder, body of the urinary bladder, and also you can see the outermost layer called as the peritoneum, and then you can see the ductus deferens or the vas deferens, and this is the superior pubic ramus, right? And at this level you can also see another structure called as the uvula of the bladder. So what is this uvula of the bladder? What happens is, like, whatever structure you are seeing, my outline, this is like, see, you can see a triangular shaped area of the urinary bladder, right? This is called as the trigone of the bladder. Okay, whatever part you are seeing, this is called as the trigone of the bladder. Okay, so this is called as the trigone of the bladder. So what happens is, like, there is a median crest like structure which you can see here. See, you can see an elevation here. So this is called as the urethral crest. This one is called as the urethral crest. So along with this urethral crest you can also see the prostatic fascia here, and then the prostate, and along with its prostatic urethra, and in this central region of this, in the mid region of this prostate gland, while this urethra is coming down, it is little bit bulged, right, in the mid region, and this bulge is nothing but called as the seminal colliculus or variomontanum. Okay, this is called as the seminal colliculus or otherwise the variomontanum. At the same time, like, this is the urogenital diaphragm with sphincter urethra muscle in the deep perineal space. Okay, and this is the bulbourethral glands, and rest of the structures which are below it we don't need to see it now, but we will see it later. So but what we have to remember is, like, the structure in coronal section, you can see this is the prostate gland, outline of the prostate gland with the fascia, right? And also this is the membranous, the prostatic part of the urethra with the central widening called as the seminal colliculus or variomontanum. So what is the speciality of this central region, right? So what it will form is, like, as you know, you can see this midline is nothing but called as this elevation is called as the urethral crest. I'll show this one again in this picture. So this is a section of this coronal section again with the prostate, with the yellow colored part is nothing but the prostate with the prostatic part of the urethra here. So within this urethra there is a central elevation called as the urethral crest. Okay, so this urethral crest, it will end at the level of the, like, neck of the bladder, where it forms a sphincter called as the internal urethral sphincter, and this region where the urethral crest ends is nothing but called as the uvula of the prostate. So this uvula of the prostate is nothing but, it is the region where behind it you can see the median lobe of the prostate gland. Along with this you can also see most enlarged part in the middle, so with an central opening, right? This central opening is nothing but the opening of the utricle of the prostate. This is the utricle of the prostate, and on either side of the utricle you can see the openings of the ejaculatory ducts. And what about these small openings which are seen along the urethra, the prostatic part of the urethra? These are nothing but called as the prostatic, like, sinuses, okay, where the glands will open into this region. Okay. this is the opening of the prostate glands. So this areas is nothing but called as the prostatic sinus. So you can see the name, this area is completely called as prostatic sinus with the opening of the prostate glands. Okay. Now coming to the next one, to explain you about this ureteric uvula. So you can see this is the edge of this trigone. This is the end of the trigone, that is the lower part of the trigone of the urinary bladder, and at the level of this trigone you can see an elevation here which is called as uvula vesicae. At the same time you can also see the internal urethral sphincter which is formed, and the prostate, substance of the prostate with the seminal colliculus called as the verumontanum. Okay, and the central region, this line bar like structure is called as the urethral crest. Okay, so this is the importance of this uvula vesicae. Now coming to the zones of this prostate. So lobes of the prostate, anatomically though they are divided into three, surgically they are very important. Surgically they are divided into 5 lobes. So these 5 lobes contains, as I told you, the prostate is a fibromuscular gland which contains compound tubulo-alveolar glands. So these glands which are there, what happens is like these glands will divide this region into 3 zones. Okay, previously I said that there are 5 lobes, but now I am saying that there are 3 zones. So why they are divided into 3 zones is like the zone which is very near to which is surrounding this urethra is called as the transitional zone. Why it is called as the transitional zone? Because in this region there is urethra which is formed by the transitional epithelium. As a result, the tissue which is surrounding this urethra is called as a transitional zone, and it contains the prostatic glands. And now the second zone is called as the central zone. You can see just behind this, you can see a part here, shaded part called as the central zone, right? This sky blue color shaded part is the central zone. And now the largest one is called as this sea green colored one. It is the peripheral zone. So the peripheral zone is the one which contains the largest number of glands, where actually each prostate, generally in case of males, this prostate gland contains 20 to 50 glands, tubular-alveolar glands, and in these glands are maximum seen, and the largest glands in size are also seen in this peripheral zone. Okay, and there is another zone here called as the anterior region, which is non-glandular, and mainly it forms the stroma of the prostate gland. Along with this, you can also see the openings of this vas deferens. You can see this ejaculatory ducts, how they are going, and they are opening into the prostatic part of the urethra, and this area is nothing but the area of the seminal colliculus. So in this way these zones are present, but surgically this prostate gland is divided into 5 lobes. So if you take this picture, you can see this is one side, this is purple one is one side, on either side 2 are there, right? So these are nothing but the lateral zones, lateral lobes, and also now you can see a light green colored shaded part which is the anterior lobe of the prostate, and now you can see the urethral opening along with this surrounding tissue. So this region is called as the median lobe, and now the posterior most part which is in blue color is called as the posterior lobe of the prostate. In this way we can see surgically there are 5 lobes: anterior lobe, median lobe, posterior lobe, and 2 lateral lobes. So if you look in the sagittal section, this is the coronal section of the prostate, but if you look in the sagittal section, what happens is like in the sagittal section you can see this is the anterior lobe, and also now this structure whatever you are seeing, this is the ejaculatory duct which you can see, and this is the seminal colliculus, and now this is the urethral crest, right? So what happens is like this is the ejaculatory duct, and this ejaculatory duct, as it is traveling to end up in this prostatic part of the urethra, clearly it has divided the posterior lobe into 2 regions, right? So this one is sky blue colored, this one is called as the posterior lobe on either side, and but the region which is above this ejaculatory duct, now this pink region is called as the median lobe. So why we have divided surgical into 5 lobes is because median lobe is the most commonest lobe which is involved, which gets enlarged in case of the benign prostatic hypertrophy. So now coming to back to this structure. So this is a prostate, and what is this BPH, benign prostatic hypertrophy? This benign prostatic hypertrophy is a common symptom, which is common problem which is seen in mid-aged to very less mid-aged people, but more commonly seen in the elderly people. So what happens is, like, during this benign prostatic hypertrophy, the median lobe, which is seen here above the ejaculator duct, this is the region which gets inflamed or enlarged in size. And coming to the dimensions of this prostate, the prostate has a dimensions of 4 into 3 into 2 centimeters. So the 4 centimeters is nothing but the width of the gland is around 4 centimeters. That is the transverse diameter of this prostate gland is around 4 centimeters, while the vertical length is 3 centimeters, which means that the transverse diameter is more when compared to the vertical diameter. And also you can see the thickness, that is the anteroposterior length or anteroposterior diameter of this prostate is around 2 centimeters. So please remember 4, 3, 2. 4 is the transverse length or the transverse diameter. Okay, 3 is the vertical diameter and 2 is the anteroposterior diameter. These are all the dimensions of this prostate gland. So what happens is, like this, if you look at this prostate gland, it is in close relation with this ampulla of the rectum. So in case of any benign prostatic hypertrophy or in case of any carcinoma of the prostate, where the posterior lobe of the prostate is commonly affected in case of carcinomas, in this case what we'll do is, like, the surgeon will perform a perrectal examination where his fingers will come and will be touching in this region, that is the rectal ampulla. So when there is any enlargement of this prostate gland due to benign prostatic hypertrophy or carcinoma, it can be very easily palpated through this anal canal at the level of the rectal ampulla. So generally, if you look at this one, so the level of this prostate gland from the anal canal is approximately 4 centimeters. So approximately 4 centimeters deeper to this anal canal. Okay, this is all about this prostate lobes, right? And also now let us go into the blood supply of the prostate. If you take the blood supply of the prostate, basically the blood supply comes from the internal iliac artery. Okay, this internal iliac artery gives a major branch called as the inferior vesical artery, and also which continues as the prostatic artery. So within this prostatic artery, it also gives capsular branches, okay, which supply the lateral lobes and also the median part of the prostate gland. So, and also you can also see that the prostate also can be supplied by the superior rectal artery and other arteries also, right? And now if you go into the venous drainage of this prostate gland. So the venous drainage is very, very important in case of the prostate. Why? Because during any prostatectomies, that is during the complete removal of the prostate, the surgeon should be paying most attention about this venous plexus. So all the veins which are there surround the prostate gland, they form the kind of venous plexus called as the prostatic plexus of veins. So these prostatic plexus of veins, what happens is, like, they will be completely surrounding the capsule, and these prostatic plexus will be lying within this internal capsule and the external capsule, that is a true capsule and the false capsule of the prostate gland. So all these veins, after collecting the venous blood, they will be finally draining into the internal iliac vein. And also all the branches which are supplying this arteries which are supplying the prostate comes from the internal iliac artery. So, and also here you are seeing the internal iliac vein. So what happens, why it is important for regarding this prostate gland is because this is a transverse section of the prostate. You can see the central region, right? This is nothing but the prostatic urethra. And along with this prostatic urethra, you can also see this is the prostate gland's proper main prostatic glands, because as I told you, this is a peripheral zone. So maximum number of prostate glands and the large sized prostate glands are seen in the peripheral zone. So you can see again the submucosal glands and also the mucosal glands which are inside. And if you see this one capsule which is tightly adhered to the substance of the prostate and also very tough in nature. This is called as the true capsule of the prostate. So at the same time, we can see between this is another green colored structure which is called as the false capsule of the prostate, which is formed by the prostatic fascia. But in between this prostatic fascia or the false capsule and the true capsule, you can see the prostatic venous plexus. So these prostatic venous plexus, they completely surround the prostate gland. So as a result, in case of any prostatic cancer or in case of any benign prostatic hypertrophy, when the surgeon starts operating for the removal of the prostate gland, first only the interior substance of this prostate gland is removed or completely pulled out, because the surgeon will never touch this prostatic venous plexus, because once if they rupture these prostatic venous plexus, as they are very numerous in number around this prostate gland, what happens is like any injury to this capsule, true capsule and the false capsule, can lead to severe hemorrhage during the surgery time. That's the reason why what happens is like the surgeons will leave away, they will leave away emptily, that is the true capsule and false capsule, and they will only try to scoop out the substance of the prostate gland. So this is the importance of this transfer section of the prostate. So this is all. And coming to the venous supply, these veins which are seen in between the true capsule and the false capsule, they ultimately drain into the internal iliac vein, and also these venous plexus are connected to another kind of plexus called as the Batson's venous plexus. These Batson's venous plexus are seen around the vertebrae, and they travel from the region of the coccyx up to the brain. Okay, so any case of carcinomas, any carcinomas which inflammates or which invades through these veins, so those carcinoma cells can directly easily pass through the Batson's venous plexus, and they can even enter the brain. So most of the people with this BPH and also like prostatic cancer, they have died due to the metastasis which are basically seen in the brain. So this is the importance of this Batson's venous plexus regarding the venous drainage of the prostate gland. Coming to the lymphatic supply, this prostate is the lymphatic drainage occurs through two important nodes called as the internal and external iliac nodes. Okay, the internal and external iliac nodes. So at the same time, nerve supply comes from the L1 and L2. So this means that these L1 and L2, they send the hypogastric plexus, which are nothing but useful in the contraction of the prostate muscles during the ejaculation. And at the same time, while during the ejaculation, once these muscles starts contracting, these L1 and L2 superior hypogastric plexus also helps in the complete contraction of the internal urinary bladder. So now let us see the relations of this prostate. If you take the relations of the prostate, you can see that this prostate is anteriorly related to the retropubic space or space of Ridgius, and posteriorly it is related to the Denonvillers fascia, and also inferiorly it is related to the urogenital diaphragm, and superiorly it is related, that is the base of the prostate is related to the neck of the urinary bladder. So this is all about the prostate and its clinical importance. So BPH is nothing but called as the benign prostatic hypertrophy. In this case, what happens is like generally the patients will be complaining of pain during the urination or micturition. So pain during micturition can be of many kinds, because one can be due to it can be due to dehydration, second it can be due to any infection of the urinary tract, and the third important cause in males, especially in males, might be due to this prostatic hypertrophy, that is the benign prostatic hypertrophy. Please remember, in case of benign prostatic hypertrophy, the median lobe is involved, while in case of the carcinoma of the prostate, generally the posterior lobes are involved. So in case of this, due to the complete due to the enlargement of this median lobe, what happens is like once the median lobe, you can see this one, once the median lobe is mostly affected in case of the benign prostatic hypertrophy, once this median lobe is enlarged, it can also compress and also inflame the lateral lobes. As a result of inflammation or the increase in size of these lateral lobes and especially the median lobe, what happens is like it will push or it will force the prostatic part of the urethra to close. As a result of this not closure completely, but as a result of this narrowing of the lumen of the prostatic part of urethra, generally the patient will be complaining of pain and burning sensation while micturition. So this is all the surgical importance of this prostate gland. And also, like I told you, the prostate gland is around 8 grams in weight. So it has got 4, 3, 2 the dimensions, that is 4 is transverse diameter, 3 is vertical diameter, and 2 is the anteroposterior diameter, along with the weight of 8 grams. So this is all about the prostate. And if you have any doubts, please feel free to contact me. And I thank you for listening for this class. Thank you.